if I was a lady, there was a family history, my genetic testing wasn't done, and I get vague symptoms of increased abdominal girth. My clothes just don't fit as good. They feel tighter. I'm eating food, but I get full easily, and I've got frequent urinary tract irritation, so I go to the bathroom frequently. What would you do to help diagnose? What kind of testing do you do to help diagnose the ovaries and see if they're normal or abnormal?
In that situation, I'd recommend they go see their family doctor or their OB/GYN, tell them of their symptoms. If these symptoms persist, they do need to have them checked out. Most of the time they'll have a pelvic examination at the office.
Can you feel the ovaries well on an exam?
Sometimes you can, sometimes it's a little difficult on each individual patient. If we can't feel the ovaries, or if you're not sure on the exam, that's when we usually recommend getting an ultrasound to look at the ovaries, or if there's a significant abnormality, then we might get something like a CT scan to look at the rest of the abdomen and the ovaries.
So if you get an ultrasound, is that an abdominal ultrasound where you run the ultrasound over the belly, or is it transvaginal?
Sometimes it's usually a combination of both. Most of the time the ladies will get an abdominal and a vaginal ultrasound because it gives you a better picture of the ovaries when you're looking at it.
Usually, how close is the ovary to the vaginal vault?
It's just a few inches away.
So it would be much closer than if you ran it over
Correct.
the belly. We get really good definition of pictures when we do ultrasounds. Is the transvaginal, is that a good picture taker for ultrasounds?
It's the best option we really have for viewing the ovaries.
So what does a cancer look like? If you do a transvaginal ultrasound, what does it look like? Can you see irregular borders? It's got a different size?
They may be enlarged. That's one of the things you look at. You also look to see if they have solid areas inside the ovary, or if there's fluid around the ovary, or there's other characteristics that they almost look like they have a little mushroom stalk inside the ovary called a papillary excrescence. That's another thing we look at. And if you have those, you're at a higher risk for that ovary being abnormal.
So if somebody has a positive, let's call it, it looks like something's abnormal there in the ovaries, is that a sign that you're going to do what?
At that point, if it is an abnormality, most of the family physicians or the OB/GYN doctors will order some blood work, and usually they get a CA-125 test.
CA-125.
CA-125. That's a blood marker that can be elevated in most women who have ovarian cancer. About 80% of the women with the most common type of ovarian cancer have that to be elevated.
Is it a sign, the CA-125, of activity in the ovary?
It's not really a sign of the activity, it's just that there's an abnormality that puts it at a higher risk for being malignant.
So if somebody has a abnormal ultrasound and an elevated CA-125, it makes the suspicion much, much, much higher. Then how do you find out?
At that point, a lot of the times the family physician or their OB/GYN will refer them to somebody like me, and then we may get a CAT scan to look and see what's there, but usually we have to perform some sort of surgery to look inside the abdomen to see if the ovary does have abnormal cells on it.
So you can look into the abdomen. What do you call that procedure?
Laparoscopy.
Laparoscopy. And so you can visualize the area of the ovary and see what it looks like to the human eye there.
Correct. And you can either take out the ovary then, or you can do biopsies of other areas inside the abdomen to see if they show that there's cancer cells there.